Hello, welcome back. My name is Pam with Perfectly Holistic, and we are back for some more really fascinating education because there is so much to learn in the alternative healing space. And I am just fascinated by new modalities that I haven't learned about before and how they work. And as you guys know, I am super passionate about a holistic approach with cats and just animals in general, including ourselves. So I'm so excited to bring on my friend Poppy Phillips with Holistic Animal Insights today. And she is going to educate us on iridology. And I'm super jazzed about this. Thank you so much for being with us.
Pam, thank you for having me. I love iridology. So what I was taught, because I was always calling it iridology,
Iridology.
like,
Iris. Is it like
mentor
iris?
was like, this is ear, this is eye.
Eye.
But everybody does say iridology. So
That's hilarious. Oh, I love that. I love that. So iris, yeah, well, like iris is the eye, so that makes sense. Yeah. Hello.
that's exactly what I said too, Pam. I was like, oh yeah, that does make
See,
sense.
we're already learning. I love this.
Yeah. So my mentor, I thought iridology was a joke. And I was going to Kingdom College of Natural Health,
Yeah.
an online
Yeah.
holistic college doing their animal naturopathic certification. And they offered this as like a weekend course, and it was cheap. It was super
Yeah.
cheap, and I didn't believe in it. I thought it was way too woo-woo. I was like, that's super odd. And I'd heard of it. And then I kind of pondered it and I went, it's cheap. I'm going to just take it. I can say that I'm a certified animal iridologist after a weekend. And
Yeah.
why not? It's just going to set me apart. And so halfway through the presentation, I audibly gasped. I was just like, oh my gosh, this is actually real. And I totally didn't want it to be real. I thought it was
Mhm.
just too out there, but there's legitimate science behind it. And now, scientists are studying the retina
Mhm.
and they're learning that Alzheimer's and dementia marks in the pupil before it shows up in the human.
Wow.
Yes, and we're seeing the same in animals. We can see their neurologic issues before the expression of the disease. So we can actually be pre-disease heads up warning with iridology, which is crazy exciting.
That's so exciting because it's almost like your little red flag that starts to go up before you get anything showing up, maybe symptomatically, maybe on blood work or, whatever else scans, diagnostics you're doing. If it's all coming up clear, the eyes may tell a different story.
Yeah, so I always tell everybody every eye tells a story. And if you love your pet and you look deeply into their eyes, you probably might have already noticed like a mark here and there. And maybe even you went to the vet and went, what is this? And the vet probably gave you some answer like, not a big deal, don't worry about it. But the more we're learning, every mark tells a story. So Pam, you actually had a fun little experience with me on your cat.
I did. So you guys, so Poppy said, well, send me a photo of one of your cat's eyes and let me just look at them. So I pulled out one of Aylin's pictures because she has such beautiful eyes. And this was like, what, 2 months ago, 2.5 months ago? It was a while ago, right? And so I sent her a picture of Aylin. And then when you got back to me, you said,
Looks like a hind end or a kidney
yeah,
issue
something's
because
going
the
on in
marks
her
are
hind
really
end.
close. Yeah, so the marks are really close. So I'm like, something going on in the hind end, and it was a not bright mark, not a dark mark, but it
Correct.
was just kind of there, and I was like,
Right.
that's a heads up there.
Like a shadow or something, you
Mhm.
know? So I thought, well, that's weird because I don't notice anything. I mean, the only thing I immediately thought of was sacral chakra because we'd had all of these cats and spirit visiting and fairies visiting. And of course, cats can see all these orbs and everything, and they were just freaked out and they would get scared. And sacral chakra is that bladder, water element, fear, whatever. So I was just chalking it up to, oh, it's probably that. And then something kind of, I don't even remember what it was. It was, what, a couple weeks ago?
Yeah, I think
Something
so.
something, like, clicked, and I thought, "I need to go check her bladder." Because maybe it's because Gunnar was going through a UTI because of, hello, fear, and, stress from that. And so I did some testing and analysis on her, and sure enough, wouldn't you know, bladder, like a low grade bacteria was resonating with her bladder. I'm like, holy cow.
Isn't
So
that amazing?
I put her on homeopathy figured out which homeopathy to use for that. Um, but yeah, so I like to muscle test things, and I know you're an avid muscle tester too. So I
Absolutely.
tested it like on a scale of severity, like from 10 to 100, with 100 being the worst. Like, how bad is this infection that she supposedly has? And it was a 30%. I'm like, so something low grade, that's like just disturbing the force, so to speak. It's there. It's been there for how long? But I
Right.
think it's due to all of her fear and her, water
Just
element cat that
yeah.
she is. And that she was just, I had no idea. I'm like, I feel like a bad mom.
I know. Well, it's funny because when I first took the course and we took animal eye photos for our final exam, I took a picture of my horse, which is one of the examples I have today.
Yeah.
And I cried when I took a picture of my horse. I've been an animal naturopath or in the animal natural health industry since 1998.
Oh,
And
wow.
so I've done muscle testing for years. I was mentored by a neuro um, doctor who did research on nuclear medicine and things like that. So when I saw my horse's eyes, I was like, this can't be, this is horrible. And I do muscle testing. So it's really complimentary to be like, okay,
Hmm.
look in the eye, see a certain quadrant. So basically you read the eye from 12 o'clock to 6 o'clock and it's head to hind leg and
Mm.
everything falls in between. There's about 42 marks on the left eye and about 41 marks on the right eye. It's ever changing and evolving. I have a membership and we're literally doing research and comparative studies on animals. We have 4 veterinarians that help us, and we just are taking in eye photos and trying to up level iridology. It's now like a passion
Hmm.
for me, and we're discovering and we're
Wow.
evolving it. So it's just, I got goosebumps just talking about it. Um,
Yes.
and so you can do your muscle testing with the Iris Insight. And
Hmm.
often I've had cases where vets were absolutely stumped. The muscle testing is broad. You can get
Yeah.
so much information from muscle testing. You're kind of like, where do we start? Like
Hmm.
I love that you go from 1 to 100. I just go from 1 to 10.
Hmm.
So you're getting a much more detailed answer from that. And so, but when you look in the iris and you see maybe a bladder mark or a hind leg mark, and the right eye controls the right side of the body, the left eye controls the left side. So each eye reads totally different, and it's
Wow.
super cool.
That is so cool. So for people who are joining us that have never heard of iridology, can you give like a brief little background of how this come about? Like, who developed it? Is this part of the Chinese medicine? Is it, Eastern medicine philosophy or anything like that? Or
I think the very earliest recognized iris plates were from Tutankhamun's tomb.
wow.
So the priests were actually iridologists.
Wow. So
Yeah.
we're going
Well,
way back.
ties into your cat thing
Yes.
to some degree. But yes, so Howard Carter, when he excavated Tutankhamun's tomb, he found these iridology plates.
Wow.
And so it started, at least back then that we know of. It might have started much, much earlier too. There's a lot of documented history in iridology. And then Bernard Jensen brought it to the United States. He's kind of the founding father for the United States. And my mentor, Mercedes Colburn, was a protege under him.
Oh,
And
cool.
so I feel like I'm generation 3 on this. So yeah, and so I feel like I have to keep the flame going and up level it. And now that we do have retina testing and, they do the retina scans and things like that. And now they're finding out that science and woo-woo are matching. So it's the
Yes.
study of the colored part of the eye. The pupil's not normally included, but you can tell things from the pupil and the sclera also. But
Mm-hmm.
just looking at the colored part of the eye, you'll notice different textures, different colors, blobs, streaks, things like that. Everything
Mm-hmm.
means something.
Mm-hmm.
Now, you can't diagnose, but you can kind of point yourself in the right direction. So you might see a little highlight on a metabolic issue and go, there might be
Mm-hmm.
like maybe a thyroid issue coming, or if you're already managing a thyroid issue, you can make note of the marks and track your animal's progress. So
Yes.
that's part of the really fun thing is your protocol working? You can see it in the iris. If your pet is heading in the right direction, you'll see the eye clear up. And if it's not working for them, you'll see the eye darken. And it's just
Mm-hmm.
as simple as that.
So interesting. So so we have, okay, so we know how you got into it. How do you use iridology with your clients, and what are they thinking about this amazing technique?
So initially, I was just adding it to my practice. Is just before COVID, I was driving out to people's property and doing
Mhm.
horses and just, snapping a photo of the eye and noting it and just going, hey, you see these marks. This is what it means. You want to be proactive about this, and you should see the marks diminish. They may not go away, but they should diminish. And so initially, we were taught iridology, the eye didn't change. Now we know it's totally not true. The eye
Right.
changes radically, instantly. Like you can put a homeopathic pellet in their mouth and their eye pops. Like it's that fast.
Wow.
It's so crazy. And I'm sponsored by an ozone company. And so I was feeding the horses a little bit of ozone water, and their lung points were just getting crisp while they drank it. Well, they were inhaling the ozone, and that's not good. And so we were like, is this good or bad? I'm like, oh, that's not good. So yeah, off gas the ozone before, because the horse's nose is right by his mouth. You have to kind of come around to this side. So I learned from that. I learned I was hurting my horses with doing some ozone flushes in their mouth and having them just grab that gas.
Wow.
Yeah.
Interesting. So interesting. So, okay, I know you mainly have worked on horses and dogs, is that right?
I
Even though
don't Well, in my practice, I don't know much about cats. It was originally a horse practice, and then people
Mhm.
started bringing me dogs that were falling through the crack in the medical field, and the muscle testing works on everything. You just need to
Mhm.
know the questions to ask.
Mhm.
And
Mhm.
so I've done everything from sea lions to bees,
Oh,
but
wow.
people have to help me with those creatures.
Yes.
I don't really know about these animals, so you guys are gonna have to filter the questions through me. And so cats aren't my
Yep.
jam. I
Yep.
want to learn more about cats. That's part of the reason why I reached out to you.
Yeah.
So you're kind of the cat queen.
And you have a kitty.
I do. I've had barn cats for years, and but this one's extra special. She's my most favorite. She was a little Mexican street cat that got pulled off her mom too early, and so
Oh,
she thinks I'm her mama, and she's barn cat by day, house cat by night.
I
She's
love that. Yeah.
so she's a vicious natural born killer during the day, and then just a little. She has her own guest bedroom. Yeah.
Of course she does. She's a little princess. Okay, so let's dive into some things that you wanted to show us because this is so fascinating. I'm excited to learn. And by
Okay.
the way, thank you guys for joining us. No matter where you are joining from, drop us a note. Let us know if you have any questions as we go through, because we will definitely be happy to answer questions as we go too. Okay.
Excellent. So
Yeah.
this is the first set of eyes I ever did, and this is my own horse after that weekend class I
Mm-hmm.
took. and I had to submit eyes for certification. And this was the set of eyes I said, and this is the horse that I cried over, because this darkness is not necessarily a great thing in the overall color. And so through the muscle testing, I actually just, it's like the whole eye is toxic. The hind and front leg we're highlighting. There's some hind marks in here and front leg issue in here. Metabolic concerns in this area, and stresses and parasites up in here. And these are like stress lines. And so muscle tested, all I did was double his humic acid product. And I didn't really know what to expect, and I wasn't really gauging it. And I literally was taught in that class, you really can't change the eye that much. But after 45 to 60 days, I was like, hey, those are really changing. So I took these photos and sent them to my instructor, and she went, that's impossible. And I went, what? I was shocked. She goes, you can't do that. I go, I just did. I didn't know I couldn't. Like,
Right.
it never crossed my mind that I could or couldn't. And so obviously the eye is less toxic, less, like all the dark chronic degenerative marks are lightening up, less stressed. And then overall, his body was visually much healthier. Like, he looked so much younger. It was amazing.
Oh, wow. I bet he felt better too. You probably noticed his energy different, and maybe a little attitude, happier maybe because he felt better.
It was miraculous. It was night and day different. Like, he went from an old horse to a young horse, and he went from kind of non-riding to riding again.
Oh, wow. That's huge.
And all I did was double his humic acid product. Isn't that crazy?
It's amazing.
And here's a recent cat case the owner gave me permission to share today. I was so excited that at 4 p.m. on Saturday, she sent me these photos, and she's been a client of mine for like 20 years, I think. And she goes, I remember you told me about the eyes. My cat just came in at 4 p.m. with eyes looking like this. I am afraid she is in a major, major crisis. And I was like, this is super interesting. And this stuff is all like spine, bone trauma, and just overall stress. And so I was like, you've never seen her eyes like this? She goes, no, I've never seen them like this. She came in, looked at me. I freaked out. They sent them to you. And I go, I think she was actually in a fight or got in some trouble. It's a cat that lives in Santa Barbara, next to a nature preserve, and the owner lets her just go out and do whatever. And she comes in with dead animals and things like that. And I literally do this pet prayer process with my clients. So we did a prayer, and I recommended some homeopathy. And at 9 p.m., she sends me these eyes. And in 5 hours, it was totally resolved. And I was like, wow, that homeopathy did really good. And she goes, I didn't do it yet. It was off the prayer.
Prayer.
Yes.
Wow.
Isn't that crazy?
Yes.
Look at the change in this. Here and here, and it cleaned up, and even the stress lines on the side. There's a little bit of mark in there, but nothing incredible. And seriously, I've never seen a case like this. So I couldn't wait to share this.
Oh my gosh. So I have a question. Which remedy did you recommend, and did she ever go through with the remedy?
No, she never did.
She never did.
Her cat like totally was normal, because you see eyes like that and you're like, is she neuro? Is she sore? Is she painful? Like, what's her level of awareness and vitality? And she goes, she seems okay, and so I'm like, I think this is just like a sudden onset trauma type of thing. And there you have it. So like I said, every eye tells a story, and it can be really responsive in a matter of minutes.
Wow. We have a question. Teresa says, can you share the prayer that you give?
I can. Thank you for asking. I pray for all my clients before I work on them. So I always set a prayer of intention before muscle testing anything. And so I definitely can do that. Let me get through this and then I
Yeah,
will share that. And then
absolutely.
here's a dog case that I was new to iridology, and it's my own dog, and he started going neurologic, and I had taken these photos in 8/17 of this, and I didn't know what I was looking at, you guys. Like, you can't like see an eye and go, oh, there's a spinal tumor in there. But we're recording things like that to try to prove some consistency.
Mm-hmm.
And so he was going neurologic. I went ahead and got the MRI, and it showed a tumor in the L4 area, the back of his
Mm-hmm.
lumbars,
Okay.
or the middle of his lumbars, which kind of sat on his kidney and made him a little drippy and incontinent.
Mm.
Well, he gradually went more and more neuro, and so I opted to do the surgery in October, and this is post-surgery. You guys, look how different, but
That's
there's still a little glitch in there,
mm-hmm.
and his GI tract cleaned up quite a bit. I'd done raw with him, but I rolled into a ketogenic diet at
Yeah.
this point. And so the eye is clearer, less stress, less redness, less GI tract issues. There's some weird fibers in there, and the marks had changed. Well, in about 4 months after that, this little mark started growing again. And I was like, oh, we are losing ground. And I talked to my vet about it. And he was like, no, you're imagining things. And I was just like, "No, I don't think so." So, I went back and kept, like, monitoring that, and it grew and grew, and then he was fully neuro again, and he was like,
Mm.
"Oh my gosh, you're right." So, he offered me an MRI at cost, and I was just like, "Let's do it just for science."
Yeah.
And when he got the MRI results, I go, "Do not tell me the results, I'm gonna tell you the results." And he was like, "You're an idiot."
No, I'm smart.
And so I go, it's bigger than ever, and there might be 2 of them because those marks got really large. And he goes, "How in the hell would you know that?" And I showed him my iridology, and he was just so fascinated. He was a neurologist, a
Mhm.
canine neurologist, and he didn't discount it. He was like, "I cannot believe that." So it was accurate to the MRI, but if I hadn't followed the whole case, I wouldn't have looked at that eye and gone, "Oh, there's a tumor marker," or something like that.
Right.
So
Right.
we all learn from assessing,
Mhm.
observing. Yes.
That
And
is fascinating.
so what iridology doesn't really work on is really black eyes. So if you
Mhm.
have a cat or a dog or a horse with really, really dark eyes, it's hard. You can like tweak it in your contrast and in your
Mhm.
editing and try to make the eye pop. And you might see a little mark here and there. It's hard to get their eye photos, you guys. So horses have these big, pretty glossy eyes that's so easy to video or photograph. But cats and dogs, you'll have to like have friend dangle, extra lighting maybe, and it's
Yep.
irritating for them. So you have to like stand back, zoom in, and try to get enough natural light.
Yeah.
Um, but recording it, you can freeze frame multiple photos and then just kind of compile a composite where we can like look at enough photos to kind of piece it together.
Yeah.
So medication. Some of the anti-inflammatory medications knock the nerve markers out. So you'll get this flat, clean, beautiful, healthy eye and get a false positive.
Mhm.
And we found that out by accident in our membership, studying eyes. And finally, I was like, I know the history on this animal. This eye is way, way too clean. Is he on medication? And they're like, yes. And then we started tracking all the animals on medication, and all their eyes on a certain painkiller looked amazing. And it just deadened the nerve endings. It didn't mark.
Wow. That's incredible.
It is. It's
And
amazing.
that's what those drugs are designed to do. But who would have thought that they would be coming up in the eyes and showing up that way? That's so interesting.
It is. And you can also see like medication marks from like steroids. We have a
Yeah.
dog we're tracking on steroids, and the eye looked like it was peppered. And as it's weaning off the medication, the peppering's going away.
Oh, wow. That is
Yeah.
interesting. Do they know what causes that peppering look, the coloration in the eyes? Is it blood vessels? Is it like what is it that makes those different colors? Or the
That's such
shadows or the.
I wish I could answer that. That's a great question. I'm gonna find out. So it's the optic nerve and the nerve endings, but I believe the blood vessels definitely have something to do with it. On the sclera part, the white of the eye, it will also mark, but incredible trauma, near death or nearing death,
Yeah.
you'll see a salmon color. You'll see like blood flood the
Mhm.
sclera. And so we've been able to track that. One of our members, who's an excellent equine iridologist, she took a brand new foal's eye, and it's fun because foals open their eyes right away, where cats and dogs, we're trying to track this with cats and dogs, but they don't open their eyes right away, and their eyes are a funny color. So we haven't tracked this enough. If you guys want to submit kitten eyes, I am open to taking on kitten and puppy eyes. But this foal, brand new foal, perfectly clear eyes. No marks on them, everything clear.
Mhm.
Now, what we've seen in puppies and kittens is people have sent me puppy and kitten photos after their first vaccines. They're horrible. Their eyes look horrible. And I'm just like, this can't be. This is awful. And so that's why I'm like begging people to send me kitten and puppy eyes prior to vaccination, because
Yeah.
I want to make this
Compare.
comparison pre and post vaccine. And the fun thing about iridology is they really value the GI tract. Like they were ahead of the curve on gut health as well.
Mm.
So iridologists are really, really passionate about that gut health line around the pupil,
Oh,
and
wow.
really just have talked about it for years, hundreds of years.
Can you show us another example of like one of the eyes that you had and kind of point out like areas of the eye and maybe a little detail of like this is spinal and this is gastrointestinal and this is kidney liver or just to kind of give people like a general idea of if they're looking at their pet's eyes, not to diagnose anything, but just a general like generalities of like this part of the body coincides to this part of the eye, and this is what you can look for and that sort of thing.
Well, I can either use one of the photos, or I can just tell you head,
Okay.
hind leg, and
Okay.
then usually lungs and spine.
Okay.
Yeah, so spine's on the left
The
spine
inside.
and right spine. Yeah, and you read it from like the top of the head to the tail. And then
Okay.
you have like um adrenal marks and spleen, your heart's
Yeah.
only marked in your left eye. That's
Okay.
my eye. Left eye.
Yeah.
And
Yeah.
that makes the L is the
Yes.
left hand. But when you're shooting photos, it looks different. So
Correct.
yes, make sure you always leave the tear duct in there so you can see which eye is which, because it sucks if you assess the wrong eye on the wrong chart. So we have these eye grids, and we'll walk through an assessment. Now I'm actually doing solo assessments where people are sending me eyes, and I can either just mark the eye and send it back to you, or I can do a print worksheet, send it to you. We meet on Zoom, we assess the eye together and discuss how you
Okay.
want to proceed. If do you go to the vet? Do you just want to detox? Do you need to change the diet? And so we just try to figure it out together. What your comfort level is and what your
Mhm.
animal's level of comfort is. Like if you're in a serious crisis and you have no options, then, hopefully I can give you options. One of our clients had a dog that was anorexic or cachexic, wouldn't eat. all the blood tests, animal biome tests clean, everything's clean. Everybody's like, it's in the dog's head. Iridology, the gut was so stressed. And so like the gut mark went all the way down to the hind leg mark, which is really bizarre. We do see it, but we don't see it that often. And the weird thing is the dog was on an awesome diet, but being hand treated because he wouldn't eat. So the GI tract wasn't toxic, it was stress. Well, they finally did like a scope and there was lesions in the GI tract. It was very stressed. So that was the only thing that she had done that was on point, was the iridology.
Wow. Now, what about a cat who has chronic upper respiratory stuff? How would that show up?
That would show up around your 9 o'clock mark in your lung points. And it's pretty cool. It's pretty accurate. Like you'll have your bronchial and your lungs. So it does break it down. And, it depends. It can go inner towards the outer part of the eye. The lung is usually towards the outer part of the eye. And then if you lack oxygen, we're seeing these low oxygen. We think it's low oxygen marks. We're following that to see if they are getting enough oxygen into their body. So they get like this funny little glaze between the eye and the sclera.
Okay, interesting. Yeah. So I'm thinking like for like a cat who's had history of like mold exposure and chronic rhinitis and things like that, what that would, because his mom is here. That's what I'm asking. And she wants to know where she can access an appointment for you with you. And I'm like,
Right on.
we'll get to that for sure.
I hope I give you the link, and if not, I'll send it to you, and you guys can definitely send me photos. The hardest thing has been for my pet owners is good enough photos. So
Yeah,
that is the biggest deal. Like I didn't expect to run into that when I started doing solo iridology appointments. I'm like, that won't work. Sorry, try again. That won't work. And try again. So yes, if you can get a good video, I can cut the video myself and enhance the eye too.
that's perfect. Yeah. So do you have any other interesting stories, like maybe other pets who've had chronic illness or disease or like adverse reactions to vaccines or parasites or anything like that, that
So
how it shows up?
So one of the funnest things about iridology, you guys, maybe I'll share my screen again so we can
Yeah.
see this together, is you can see if they're out of alignment.
Oh, I love that.
Yeah.
I
And
love that.
so let me see if we don't know about the horses so much, but how this fades at the tip of the eye, this has like some head trauma to it. And so this huge mark, which is spine, goes,
Mhm.
and then this goes all the way up through the face to the brain, but also affects the brain, neck chiropractic. And you
Mm.
see this mark goes all the way and touches that too.
Yep.
And
Yep.
it fades that mark right there. And that all went away and this restored back.
Wow.
So there was definitely some head trauma in
Trauma.
there. So the
Mhm.
question, often you'll see marks that coincide, like you'll be like, oh, the spine's affected here. And then you'll like read it and it'll tell the story of where did it start? Did it start here and stress the head, or did the cat get its head stuck and then just jerked around? And then this is all just nervousness, like total
Mhm.
stress, nervousness.
Yeah.
So the eyes will go, here's a little flat area where this cat's probably out of alignment. So wherever the pupil like loses its shape, kind of has little flat mark. Here it is. This is really clear at this flat mark. And if you look at it, it coincides with this white line and also this break.
I don't see your
Um,
little pointer.
let me share this better.
Okay.
Let me see if this will clean up. Does that clean it up at all?
Yes, now I can see. Yeah.
Okay. So you guys see this white line right here, which is front paw, and this flattening of the pupil. So this is a
Mhm.
insult to the front paw, but also that whole shoulder area,
Mhm.
that region.
Mhm.
Yeah. So, if I saw this, I'd be like, "Hey, go get a chiropractor and have that worked on." This eye is also the same eye, a little
Mhm.
closer up, and so the
Mhm.
tip is gone. So there's a pelvis issue, and you see this white line travels
Mhm.
all the way down.
Mhm.
So it's just describing this front paw to hind leg spinal trauma that's out of alignment. Whereas this side's not too bad, a little faded up here still, not a clean, crisp point. But yeah, look at these marks. It's just so fascinating how this like just swoops right into the top of that
Yes.
pupil.
Yep. Yep.
Such a fun case, you guys.
Are there any clues that you can give people to look for? Like, let's say you have like a senior cat, and as cats get older, they have little aches and pains, or they have maybe a propensity for kidney issues or liver stagnation, stuff like that. Or maybe their GI tract becomes a little bit more sensitive. Um, like what could parents be looking for? Just like, oh, I really need to get that checked, you know?
So it's fun because your cats look at you every day, right? And they
Right.
have these big, pretty yellow, at least mine does. Mine has these
Yeah.
big, pretty yellow eyes, and I'll be like, oh, you have a black mark in your eye today. And so if you see something dark, right there is kind of a heads up, a warning of detox,
Hmm.
cleanup. But I teach it, or you can jump in the membership. We do an iridology practice class every single Monday, first Monday of every month. And we go through like 4 sets of eyes and we assess it just like I did for you right now.
Oh, cool.
And we have these discussions, and some veterinarians hop on board and share their own cases. So we just keep up leveling this. But as a pet parent, this is such a fun, fun tool for you to look. They say the eyes are the window to the soul.
Yeah.
Well, it's also the window to your pet's health and wellness, as well as you. And human eyes are a lot more complicated. Like, I am not a human iridologist. They're like, your father's eye, your father's genetic marks come here, and your mother's genetic marks come here, and blue eyes versus brown eyes. We aren't that advanced in
Yeah.
animal iridology. And I was taught that there's genetic markers in the animal's eyes. I'm actually not seeing it. So
Mm.
we have taken like sires and dams and puppies, and we haven't, maybe because the puppies are so young, we are not seeing like specific genetic markers. But what you can use, if you are a breeder, you might look into your potential sire's eyes and go, no, thanks. I don't want to breed to you. And so you can use it to that level. Or,
Yeah.
maybe I don't want to breed my cat because she's had this chronic issues, skin, hair allergies, things like
Hmm.
that. And some
Hmm.
of the prettiest eyes are the sickest eyes because they have all this coloring and modeling, and you're just like, look how pretty that is. But actually, they're like allergic messes.
Wow. So the clearer the eye, the healthier the body,
Usually it is, unless on
unless
medication.
there's on medication.
Yeah.
With
So
exception.
all the fibery looks, that's a
Yeah.
heads up that there's
Mhm.
something going on. And one of my students asked me, like, is it dehydration? Some of these eyes look so fibrous, they look dehydrated.
Yeah.
We don't really know yet.
Mm.
So we're studying this, but it's definitely a heads up on stressors. And we've seen horses with head shaker disorders, and it looks like somebody scratched the iris. Like there's these little scratch marks in the brain region. And we are seeing neurologic diseases in horses before they express it, just like in human science. So we're seeing these funny little squiggly marks in the brain region. But for pet owners, color of the eye, texture of the eye, any blobby marks, they all mean something. White
Yeah.
marks, yellow marks, gray marks or brown marks, and black marks. That's usually what you're going to see. You're going to see stripes, streaks. Parasites are really easy to see, parasite loads on eyes. Um, Gosh, I have some parasite eyes if you want. If
Oh,
you have
yeah.
time, let me see how I can share this. It's on a different platform. Whoops. That's the wrong way. Oh, I haven't actually assessed these eyes. It's one of my friends who has cats, and I was like, please just send me more cat photos because I need them. And so
I can give you some more. I'll work
thank
on that for you.
yeah, I need to collaborate with you cat friends.
Yes,
Okay. Can you guys see this?
I can see it now. Yes.
Okay. So this is a really blobby eye, right? Lots of texture, lots of darkness. So
Yes.
that's some toxicity, but you see these funny, like rough patch on the pupil and then these featherings coming off. That
Mhm.
is definitely a potential parasite load. Here's more obvious in the other eye. So they just kind of streak off the pupil.
Mm. Mhm.
And then the roughening of the pupil. And then if you look at the pupil and you travel it across the eye, like you said, I always say, wherever you see something here, you're going to see something else connected to it
Yeah.
across there. Yeah. So that's and a cat, I would definitely detox, and we've got some dripping.
Yeah.
And so this would be, Pam, your lung point
Show
right
me.
in this area. So that 9 o'clock area. So you do talk about your positioning like a clock.
Yeah. Okay.
And
Okay.
this would possibly be liver down here.
Yeah. Okay. Interesting.
Yeah. And I think there's one more. She sent me a bunch of this cat. What a pretty cat, right?
Beautiful.
And then this is like acid in the stomach. Look how
Oh, wow.
flat it is on one side, bulbousy on
Mhm.
the
Mhm.
other, parasite lines, or
Mm. Mhm.
and then you can also tell if your diet's working on absorption, but it almost looks like there's scratches in this
Yeah.
cat's eye. And
Mhm.
then this is a little stress line here.
Yeah. What would that indicate there on that side? That
So
little
this
bug.
eye is slightly tilted. You guys, when you've got to remember, you're like, okay, 12 o'clock, 6 o'clock, 9 o'clock. So this could be front paw or liver. I don't have my grid charts in front of me, but it's right in that region. This might
Mhm.
be a little bit of
Mhm. Mhm.
kidney, or this could be bladder over here. Yeah.
It's fascinating.
You
Tony,
guys you guys will never look at your animals again. This is what I always tell people when I teach this. You'll never look the same.
right. Tony has a question. She says, if a hyperthyroid cat has a leaky gut or cancer, would that show up, or where would it show up in the eyes, if it would show up?
It depends in the quadrant of the body where the cancer is. So, interesting, my dog with the spinal cord tumor, it wasn't necessarily in the right area that I thought it would be. It kind of is because it's in the spinal cord mark, but also I kind of believe that because it was compressing on the spine, it was causing some pain other places. So you
Mhm.
might
Very
have to
hard.
kind of connect the dots on that,
Mhm. Mhm.
on the hyperthyroid, hypo.
Hyper.
Okay. So there's adrenal marks, different marks in each eye, and then there's a thyroid mark in the upper sides up in this area. I'm like staring at my video. I'm like,
I
wait,
know,
where
like, where?
is it? In that area. So yes, you can start gauging that, start taking photos and comparing and tweaking. If whether it's just like detoxification. So anything dark, just remember detox.
Yeah. What are your favorite detox tips?
I love humic acid. I use a
Mhm.
company. I've used a company for like, maybe 18 years called Mana Life Labs, Wujinsan and Lithicin. It's horrible. Lithicin. Everybody thinks I'm saying lecithin. I'm like, no, it's lithicin. They're like, I can't find it. So it came out long before Ion. And
Mhm.
I'm really, really comfortable with the product. So I have excellent results with it for dogs and cats
That's
and
awesome.
horses. In fact, anytime my cat gets like little dark marks around her GI tract. I'm like, there you go. Here's for you. And I was going to try to catch her eye photos today because she just recently popped dark marks around her eye. And so I did it and it went away in 3 days.
Oh,
So
wow, that's amazing. Yeah.
yeah.
So everybody get your humic acid.
Yeah, I wish I was an affiliate. I'm not.
Yeah.
So I don't get anything out of sponsoring their company, but I've seen amazing, amazing results. I like bentonite too, but I've not done a lot of bentonite with cats, so I can't speak from
Yeah.
experience on that. And then
Yeah.
chlorella. So chlorella is always a nice little heavy metal detox. And there's human studies about like arsenic and sodium and how that makes the eye have this funny little ring around it. So there are that going on. We just haven't brought it to the pet space yet. And that's my goal.
Yeah. Well, it's such a valuable tool. Why would they not want to bring it in as a complementary tool to whatever you're investigating, whatever you're testing for and all of that? Especially if it can give you insights before there's actual symptoms, physical exterior symptoms that you're actually noticing or seeing,
Exactly. Kind of
shows
a
up on the radar.
pre-disease, pre-crime thing, especially
Yeah.
the parasites. Like I've had people go, my animal doesn't really have parasites. I'm like, just deworm. And Panicure, I like Panicure for dogs because dogs get so much cancer. Panicure has been known to be a prophylactic to cancer. So I'm like, just throw some Panicure down them. It's most of the time not going to hurt them. And it might even save their life regarding cancer. So
Yeah. Interesting. Yeah, that's so cool. Okay, let's see. Maggie says, my cat had yellow eyes for a year, then they turned blue. Maggie, how old was your cat?
That's pretty crazy. And was your cat on medication?
Yeah, right. Was there an ailment of some kind going on? That would be interesting to know.
I'm just seeing the comments now. I'm laughing at Belle saying at this point I would hire a professional photographer. You guys, you can tape on your cell phone like a little cat toy too. And so you can hack this stuff. Remember to clean your screens. So remember to clean the cell phone back to get crisper photos.
Yeah. Okay. And then Maggie says, what about an elongated black shape on the white of an eye of a toy dog? On toy dog.
What mark? Like that definitely is a potential for a heads up for sure.
Yeah. Okay. Maggie was commenting on the other thing. She says, no medication, no vaccine, better diet. So that's the cat who had the yellow eyes, then they turn blue. Better diet. Diet makes a huge difference, y'all.
Yeah, gut
It
health.
really does. Gut health is huge.
So
huge.
you guys, the gut marks all the way around the pupil. So we call that the collarette. And so you can read that collarette and it should be like 1/3 of the eye. It should not like touch the end of your animal's pupil or not pupil, iris. Sorry about that. Iris. So yes, it shouldn't be like this huge mark in your animal's eye. It should just be balanced. And Holly, I'm missing so much of this presentation. Is it?
Yes, it's recorded. We're gonna drop it in on these two platforms, so no problem. You can rewatch it later, rewind.
And if you guys want to do a little webinar, I'm more than happy to pull together like a little mini class or something like that.
Oh, that would be so fun. Yeah.
I am working on a major course. I do want to get it race certified for veterinarians. And there's a veterinarian who's doing some great research in iridology.
Oh, wow. That's cool.
Yeah.
That's really cool. I have a question. So if you have an animal, cat or dog, for example, that has like chronic inflammation in their body, is there something indicative on the eye that would show a chronic inflammation?
That would be the color, the marker.
The color.
So normally the lighter the marker, usually what I've been taught is that's acute. Now there's some other iridologists teaching absolutely the backwards. The dark is the mark And then it lightens up as it results. It does lighten up as it results, but like on my horse's eye with all those chronic dark marks, those turned yellow as he got better. And then that one cat, that was a yellow mark. So that just vanished altogether. So chronic marks are darker usually. That's what I've been taught. I might change that stance later, but yes. And it was, yeah, the animal iridology, I'm gonna butcher his name. Ignaz von Pesky was a German Hungarian surgeon, but as a kid, he found a owl with a broken leg, and he noticed there was a mark in the owl's eye, and he nursed this owl back to health. And as he nursed the owl back to health, the mark changed. And then when he became a surgeon, he actually started documenting eyes before surgery and after surgery. And so he's the one that really advanced iridology. And it did start with an owl in our modern time, I guess you could say.
Yeah.
Yeah.
Wow.
That's kind of fun. You can do any animal, you guys. I haven't done like dolphins, but you can do, I don't know, shark eyes are black. I don't know.
Yeah, that's true.
Get close enough to a shark to take its picture. I don't know.
Wow.
I'd like to see that. But snakes, goats, anything.
Yeah. Okay, so I'm going to issue a challenge to all of our viewers. I want you guys to think about maybe taking before and after pictures of your cat's eyes before they have any kind of a medical procedure and after the medical procedure, like if they go in for a dental surgery, if they go in for a spay or neuter surgery, if they go in and they get their initial kitten vaccine or something like that. I want you guys to start looking at the before and after, because I think that would be very telling. Just an awareness, you know what I mean?
Belle's right there. Belle's in a spay on Tuesday. And you guys think of it like blood work. Like take a baseline eye while your pet is what you think is healthy. I thought my horse was pretty healthy. Wow. We totally up-leveled his health from the iridology. Yeah.
Yeah.
But a baseline eye for sure.
So interesting. Because, I just think like in this day and age, there's so many tools that we can pull out of our holistic toolkit. This is just one of those other amazing tools,
Right. And then knowledge of all the supplements, all the like everything plays into it. It's holistic, it's whole program.
Right. Oh, and I was just thinking of something else when you were talking about that. Poof.
But I love Maggie telling the story how her cat's eyes went from yellow to blue. I mean, that's really cool. And you guys will go to movies now and like check out Brad Pitt's eyes or somebody else. You'll just be looking at eyes from here on out. It's ruined your life from here on out.
Yeah. And I'm sure that there's charts online that you could Google if you wanted to like just get some general iridology, just, like the images, Google images.
Yeah, there's some eye grids out there. Not all.
Yeah, grids.
So I'm going to say some are accurate, some are not accurate. And we've actually changed some. Oh, so cool. We have legal permission to alter Mercedes' work. And so we've actually created a new eye grid that's not online yet, unless one of my students put it online, and I will call them. But because it's private information until we can prove everything. But yes. And that so interesting. You can get a general idea. Like the front leg might be in a totally different place. So yes.
Belle says, I know from my work with trauma human clients, I've had clients whose eye color has gone from hazel to bright blue, and this is due to the dissociative disorder.
So cool. Oh my gosh, Belle, that is amazing. Yes.
That's amazing.
And you should, in humans, you can track like mental health. We haven't tracked that in cats and dogs yet.
Like kitty dementia, like doggy dementia, when they get older, you can start to notice changes. It would be at the top of their eye or their
12 o'clock spot. Yeah, just look in their crown spot. And we haven't really marked a lot of that in the horse, but in the dog and cat, we've got like the medulla and the pituitary gland and that stuff, but also the stress lines. Just the stress lines alone will just tell you if So you can gauge if your animal's overly stressed. So you can, it'll break your heart, but you'll be like, oh, my animal's stressed. And you'll see like these big ropey marks in cats too, more than dogs. Dogs will get it occasionally, but cats get some seriously ropey, nervous marks in their eyes.
Maybe that goes back just to the way that they're wired as, previously, being the predator, um,
And being prey, possibly.
and being prey. I mean,
Yeah.
just their feral roots of being wild cats. They're in survival mode.
Well,
You know,
Pam, it's a good point because I actually think I see those ropey marks, those really intense stress marks in house cats more
Mm,
than like barn cats that are outside. My cat doesn't tend
yeah,
to have that ropey mark so much. Um, but I think it's really, you know, a contained environment, a suppressed
yeah,
environment for them if you're not like doing the fun things that you're doing with your cats, like
right,
these kitty kongs and things like that, which I absolutely adore.
yeah.
And so you're doing enrichment, but
Enrichment is huge for cats because they will get neurotic. They get bored. If a bored cat, a cat who sleeps all the time is a stressed cat because they're bored, you know, and
exactly.
they just need more stimulation. They need more mental stimulation. They need physical stimulation. And I know that the four walls can feel like they're probably closing in. And so opening those windows, doing the harness training, letting them outside under supervision, doing what you can in your space to enrich their environment so that they aren't stressed is huge.
Right.
Whatever that might look like, it's going to be different for everybody. But yeah,
And then Belle just said higher sensitivity, sensory, and more chemicals. So you can definitely see like drug and chemical marks. Like somebody will submit an eye and give me no history, and I'll be like, "Is this animal on drugs?" And they'll be like, "Ah, how'd you know?" I'm like, "Well, you can see it."
yeah,
Yeah. So yes. And chemicals, household chemicals.
yes.
Yes, absolutely.
And she says the walls can be a great playground. Yes, if we put the right
Fun
steps.
things up there. Yeah.
Yeah, put all the little, the what do you call those little
Jungle, like create like your whole house is
yeah, just
a
like the little platform, the ledges and all them for them to climb and jump and play and all of that. They love being up high. Yeah, that's a good point. And one of the things that people don't realize about the indoor space is you may you may have flame retardants. You may have flooring that's emitting formaldehyde. You may have new rugs or whatever that are off-gassing stuff. I mean, this is things we can't see,
right,
but
and
they
the
can also be impacting, our cats. So
tiny little creatures that are close to the ground, even the
yeah.
Wi-Fi, like my dog with the spinal tumor, he slept by the Wi-Fi. He slept by the router all the time, you guys. It bummed me out when I like put two and two together. I was just like, why didn't I plug that? You
Uh-huh.
know? Yeah.
Yeah. Well, they're lessons that we're here to learn.
Yeah. Unfortunately, they are the brunt of or the canary in the cage in that regard. So many animals, it's such a fascinating study, is so many animals and humans end up with similar issues. And so is it a spiritual
Environmental.
connection or is it environmental
Mm,
toxicity? And
mhm.
so,
Or
yes,
both.
or both.
Or
Ex-
both. Yeah, it's true. Well, I am so thrilled. Thank you. This has been awesome. Do you have any final thoughts? Anybody have any other final questions before we say goodbye? I just am so grateful for you. And I think it would be really fun to do like a little mini webinar and a little training sometime. So Poppy and I will get together and plan something
That'd
uh,
be great.
for
I
the
would love
near
that,
future
you guys.
because I want to learn more. I think it's fascinating.
It's
Um,
super empowering for the pet owner. You guys, it's just a fun tool for, I mean, just basically it's fun.
yeah,
And then it could save your animal's life on top of that
so
because you
true.
could be way ahead of things and way less vet bills.
Yeah. Okay. Before we forget the prayer, Teresa's
Well,
like,
thank
oh,
you.
it's a prayer.
Yeah, so normally I just pray for the animal's well-being. I set the intention. So normally I say, right now, in the name of Jesus, I command life and health upon this animal, head to tail. And if there's anything we need to know about it, past, present, or future, anything stressing, infecting, limiting, or restricting this animal, please reveal it and ways to heal it. In Jesus' name, amen.
I love that.
Yeah.
That's awesome. And then Maggie has one final question. Says, what about EMF pendants for pets? Have you used anything like that or know anything about them?
I have not. I've seen them on the back of like cell phones and things like
Yeah.
that.
Yeah.
And I don't know, you guys. It's a great question. I'm gonna look into this more. Thank you for all the cool suggestions, you guys, because I geek out on all of this. So
Yeah. It's
do you muscle test that, Pam? Do you muscle test your EMF pendants?
I actually have one of those oh,
On
what are
the
they?
cell phone?
On my cell phone
Uh-huh.
that I get from my naturopath clinic. And I guess you could certainly put it on the back of a collar. I mean, like if your pet wears a collar and has a tag, you could definitely put it on there for EMF protection. Yeah.
And
So,
yeah, so I know my cell phone makes me ill. I have done like use it, try to lift. I have like a TikTok where I'm trying to lift hay and I can't hardly move it, and I get my cell phone off me, and it's absolutely fine. And so
interesting.
yeah, so I try to keep my cell phone as far away from me as possible, and I'm sure it does affect
Yeah.
our pets.
I think that's called a diode. That's like a diode for EMF protection. I have them on all my electronics.
Very cool. I need to
Yeah.
do that. Thank
Yeah.
you. I'm gonna check
Cool.
that out. You guys, I hope this is fun for all of you.
Oh, it's been great. Thank you so much, Poppy. Maggie, I will share in the comments where I got my EMF diets. I'll put that in there for you. Let me
I'm
write
gonna
it
grab
down.
that link too.
Yeah, I will tell you guys where I get those from my peeps in Houston. They will mail them. Yeah. Okay, awesome. Well, Poppy, thank you so much. And you guys for joining us. Thank you for being here. And if you are watching this after that, like a recording of this, feel free to drop us a comment in here if you have any questions. And then Poppy and I will put together that little webinar and we'll dive in a little deeper and learn some more. So have a beautiful rest of your day, everyone, and we'll see you next time.
Take
Thank
care.
you.
Thank you for having me on.